Welcome to INF Surkhet. The Government of Nepal has given INF the task to provide specialised treatment and care for people with leprosy complications in the Mid-West Region of Nepal. When people suspect that they might have leprosy, they come to INF. We are very happy when they come early and we can refer for medical treatment. Often they've waited too long and already have complications of their leprosy, and then we will admit them for care of the problem. Despite the declaration of elimination of leprosy from the country, on average we see 7 new leprosy patients each month. We have a 20-bed inpatient unit where we provide treatment and care to people with leprosy complications. Complications like ulcers, reactions and dapsone allergy. Once admitted, patients get specialised treatment and care from the qualified and experienced team of medical professionals. Voluntary muscle tests and sensory tests help to determine the level of functionality of the nerves of patients with anaesthetic hands and feet. We're also able to do minor surgery here. Septic surgery is where we remove dead and infected tissue from an ulcer. By removing this tissue, the wound is able to heal much quicker. It reduces the further possibility of infection and deformities in their hands and feet. For plantar ulcers to heal well, pressure needs to be taken off. Patients either get around in wheelchairs so that they're not walking on their ulcers, or sometimes we apply a plaster of Paris so that the weight is taken off their feet. While many of our clients can wear normal shoes, some of them need to have specially fitted shoes so that they don't get blisters which can then develop into ulcers. Our staff will make sure that the shoes are well fitting, or if necessary modify shoes so that they are customised for pressure relief and protection. All clients need to be taught that no shoes is not an option when you have insensitive feet. Our orthotic appliance centre technician makes sure that each client receives a comfortable pair of shoes that not only make it easier for them to walk, but more importantly protects their feet from further damage. Once the clients receive their shoes, they walk around for at least 15 minutes to check if they fit well, or if any further alterations need to be made. With trial walking, the client initially walks for just 15 minutes, but this slowly builds up to develop hardened skin and increase the tolerance for walking. Many patients who come to INF have lived a difficult and stigmatised life. They need someone who listens to their struggle. INF Surkhet has a counsellor who provides counselling to the patients, their family members, and encourages them to live life to the fullest, not to lose hope. Our clients benefit from our occupational therapy and physiotherapy services. They participate in group therapy sessions and also receive individualised care regimes put together by our experienced physiotherapy and occupational therapy staff. These therapy sessions have greatly helped patients to increase functionality of their hands and feet. As the patients recover from their wounds and when they are ready to be discharged from INF Surkhet, they are referred to the self-care unit where they stay for 2 weeks. They learn about ways to take care of themselves and protect themselves while they are at home, working in the fields or in their kitchen. Each day, under the supervision of our self-care facilitator, the patients carry out soaking, scraping and oiling so that those with anaesthetic feet do not develop cracks or wounds that they cannot feel. They learn to inspect their feet and make sure that the skin is healthy. In the health education classes, patients learn more about leprosy and other health topics. They learn how to take care of themselves when they return home, with things like wound care, nutrition and hygiene. Patients with anaesthetic hands and feet learn how to protect themselves while they till their garden and cook their meals once they go home. During special days, such as World Leprosy Day, INF Day and Christmas Day, information about leprosy is put out via banners, posters and radio jingles to increase the public awareness about leprosy and the services that INF Surkhet provides. Once clients have completed their self-care training and have gone home, they are followed up by INF Surkhet staff to find out how they're going, how are they reintegrating back into society, and how are they going in maintaining their self-care activities. INF Surkhet thanks all the funding partners for their continued support in restoring smiles and hope in people affected by or living with leprosy. We thank each donor, big organisation or individual, whose generosity has made it possible to continue our service in Surkhet. All the transformed lives of our clients are the result of your kindness, generosity and prayer.